Good morning. Am I audible?
Yes, ma'am, you're audible.
Okay.
Yes, ma'am.
Okay. So today we'll take next topic, that is eczema. So what is eczema? It is also called as dermatitis. It is non-contagious inflammation of the skin characterized by erythema, that is redness, scaling, edema, vesiculation, and oozing. What is the definition? Eczema, also called as dermatitis, and it is non-contagious, means it cannot be spread from one person to another by contact. So it is non-contagious inflammation of the skin characterized by erythema, scaling, edema, vesiculation, and oozing. So first we see about what is natural history of eczema. So first there will be erythema, then it leads to papules with edema, vesicles, weeping, crusting, and pustule formation, then scaling, and all this leads to lichenification, and at last healthy skin without scar. So this is natural history of eczema. First there will be erythema, that is redness, then it will lead to papules with edema, then to vesicles, then weeping, that is discharge, crusting, pustule formations, then scaling. All these four stages are called as lichenification, and at last healthy skin without scars. Then morphology. There are three phases: acute phase, subacute phase, and chronic phase. In acute phase, there is erythema, edema, vesiculation, oozing, and crusting. In acute phase, there is a erythema, edema, vesiculation, oozing, and crusting. Second is subacute phase. Subacute phase, it is erythematous, hyperpigmented plaques with scaling and crusting. Erythematous, hyperpigmented plaques with scaling and crusting. And third one is chronic phase, That is lichenification. What is lichenification? It is a combination of thickening, hyperpigmentation, and prominent skin markings. You can see in the second image. That is, it is a combination of thickening, hyperpigmentation, and prominent skin margins. This is morphology. It is 3 phases: acute phase, subacute phase, chronic phase. Acute phase, it shows erythema, edema, vesiculation, oozing, and crusting. In subacute phase, it shows erythematous and hyperpigmented plaques with scaling and crusting. And in chronic phase, there is a lichenification. Lichenification is a combination of thickening, hyperpigmentation, and prominent skin markings. Then these are the typical sites of eczema. That is face. On face, there is a hair markings, eyelids, lips, then neck, front side and back side also, then elbows, wrist, groin region, knee folds, and ankles. So these are the common typical sites of eczema. That is face, especially hair markings, hairlines, eyelids, lips, neck, elbows, wrist, groin region, knee folds, and ankles. Then etiological classification. Eczema is classified in exogenous, endogenous, and combined type. Exogenous means outside cause. So for example, irritant contact dermatitis or contact allergic dermatitis. That is exogenous. Cause is outside the body. Irritant contact dermatitis, contact allergic dermatitis. These are the examples. Then second one is endogenous. Means causes within our body. For example, atopic dermatitis, seborrheic dermatitis, axiotic dermatitis, xerotic, gravitational or stasis, pemphigus, or dyshydrotic, localized neurodermatitis. So these are examples of endogenous dermatitis. And last one is combined in both causes, exogenous also and endogenous. For example, nummular or discoid dermatitis. So 3 etiological classification means classification on the basis of causes, that is exogenous, endogenous, and combined type. Then common treatment for eczema. Medications like corticosteroids, glucocorticosteroids, prednisolons, immunomodulators to suppress the immune system, antibiotics in case of infection association, immunosuppressants, for example, cyclosporin, then anti-itch drugs, mostly antihistamines like cetirizine, Allegra. So this is common treatment. These medications, mainly corticosteroids, then immunomodulators, antibiotics, immunosuppressants, and anti-itch drugs, that is antihistamines. And some other treatment like avoiding dry skin. So moisturize the skin. Use the eczema and skin cleansers. Some environmental measures to avoid the dry skin. In diet and nutrition, The dietary supplements that have been reported to trigger eczema includes dairy products and coffee, both caffeinated and decaffeinated coffee. Then soybean products, eggs, nuts, wheat, and maize. So these are some dietary elements which triggers the eczema, which has aggravating factor for eczema. The last is behavioral approach. Like patient undergoes a 6-week monitored program involving scratch habit reversal and self-awareness of scratching levels. Then we have already seen etiological classification. Then these are the types. First is atopic eczema. In atopic eczema, there is infantile eczema, flexural eczema, atopic dermatitis. So these are other names of atopic eczema. Infantile eczema, flexural eczema, and atopic dermatitis. So the name atopic, it is believed to have hereditary component. It often runs in families whose members also have conjunctivitis, hay fever, and asthma. So allergic content. Atopic means allergic. So we have seen this is endogenous type of eczema. So atopic eczema, other names are infantile eczema, flexural eczema, atopic dermatitis. It is believed to have a hereditary component, often runs in families whose members also have conjunctivitis, hay fever, asthma, like other allergic problems. It is endogenous type of eczema. Symptoms are itchy rash, particularly noticeable on head and scalp, neck, inside the elbows, and behind the knees. That is flexural surface of joints and buttocks. So these are the sites. The itchy rash mainly noticeable on head and scalp, neck, inside the elbows, and behind the knees, that is flexural surface of the joints, and buttocks. So it is called as flexural eczema because it mainly presents on flexural surface in mainly folds. In etiology, first is allergy. Eczema is primarily aggravated by contact with or intake of allergens. The etiology, first cause is allergy. This eczema is primarily aggravated by contact with or intake of allergens. It may be anything. Second is atopic eczema, consists of chronic inflammation. It often occurs in people with history of allergy disorders such as asthma or hay fever. Next, it can also be influenced by other hidden factors such as stress or fatigue. Then environmental factors, nutrition or hygiene also play a role in disease susceptibility. So what are the causes of atopic dermatitis? First is allergy, that is contact with any allergen. Then atopic eczema consists of chronic inflammation and it mainly occurs with history of allergy disorders such as asthma, hay fever. It can be also influenced by other hidden factors such as stress, fatigue, and environmental factors like nutrition, hygiene are also play an important role in disease susceptibility. Then pathogenesis. Interplay of genetic susceptibility, which leads to epidermal barrier dysfunction, which leads to abnormal immune response, and it shows atopic dermatitis. Pathogenesis. First, there is an interplay of genetic susceptibility, then epidermal barrier dysfunction, which leads to abnormal immune response and which presents as a atopic dermatitis. Then clinical features. First is infantile phase. So morphologic features of acute or subacute eczema are observed over the face and extremities of an infant. Face of the patient with atopic dermatitis has an extra fold beneath the eye, which are called as Denny-Morgan fold. Other body parts are affected in severe cases. So in first infantile phase, the main rash or main eruptions are observed on the face and extremities of an infant. And on the face, these infants have extra fold beneath the eye, which are called as Denny-Morgan fold. Denny-Morgan folds. And other body parts are affected in severe cases. So you can see in the image, atopic eczema. Then second one is childhood phase. In childhood phase, excoriated papules and features of subacute eczema over the extensor and flexures of extremities up to the age of 10 years. Means it can be on extensor part also and flexure part also. And it is up to the age of 10 years. And in this case, face and trunks are involved uncommonly. So mainly seen on extensors and flexures. Then third one is adolescent phase and adulthood phase. So it shows features of chronic eczema, that is lichenification, mainly on the flexures of the extremities, like antecubital fossa, popliteal fossa, in axilla, on wrist and ankles. So we have seen three phases. First is infantile phase. In infantile phase, the morphological features are mainly observed over face and extremities of infant. On face, they have some extra fold beneath the eye, which are called as Denny-Morgan fold. Then in childhood phase, these excoriated papules are mainly seen over the extensor and flexures of extremities. And this stage is up to the age of 10 years. In adolescent phase or adulthood phase, it shows mainly features of chronic eczema, that is lichenification, mainly on the flexures of extremities, that is antecubital, popliteal fossa, axilla, wrist, and ankles. So in image, it shows atopic subacute eczema on the fronts of the ankles of teenager. In this image, it shows atopic dermatitis with hyperpigmentation, lichenification, and scaling in antecubital fossa. Then complications of atopic eczema. First is skin infections. For example, impetigo contagiosa, cellulitis, mollusca contagiosa, and viral warts. So this eczema can be complicated with infections. For example, impetigo contagiosa, cellulitis, mollusca contagiosa, and viral warts. Then second one is irritant reactions due to defective barrier function. Then third, poor growth due to chronic disease and sleep disturbance due to some itching. Fourth one is immediate urticarial reaction due to food allergy. And obviously psychological factors for patients and their family. So complications. First one is skin infections like impetigo contagiosa, cellulitis, mollusca contagiosa, and viral warts. Second one is irritant reactions due to defective barrier function, poor growth due to chronic disease and sleep disturbances, immediate urticarial reaction due to food allergy, and last one is psychological factors for patients and their family. Then how to diagnose? So diagnosis is based on three cardinal features. First one is present or past personal or family history of atopy. Means history of atopy, it may be present or past, personal history or family history of atopy, history of allergy. Second one is presence of severe pruritus. Pruritus means itching. Presence of severe pruritus. Third one is persistent or relapsing eczema. So these are three cardinal features for diagnosis. And some other minor markers are also present like hyperlinear palmar creases, pityriasis alba, extra infraorbital fold, spring catarrh, keratoconus, and anterior subscapular cataracts. So these are some minor markers of eczema. Hyperlinear palmar creases, pityriasis alba, extra infraorbital fold, spring catarrh, keratoconus or anterior subscapular cataract. Then prevention. How to prevent? First one is diet. Allergens can trigger an allergic reactions. For example, milk, nuts, cheese, tomatoes, wheat, yeast, soy, and corn. So first, we should identify the food items which causing allergy. So this can be prevented. Then second one is breastfeeding. So breastfeeding is the best way to avoid these problems. But if that is unavailable, then hydrolyzed formula are preferred to cow's milk. Then third one is environment and lifestyle. So adults with atopic eczema should avoid smoking as well as the inhalation of dust in general. The next is anger, stress, and lack of sleep are also factors that are known to aggravate eczema. Anger, stress, and lack of sleep. And next is excessive heat, especially with humidity, and excessive coldness are known to provoke the outbreaks, as well as sudden and extreme temperature swings. So by these things, we can prevent the eczema, like first is diet. So we should identify the food items which causing allergy. Then in infants, breastfeeding is the best way to avoid these problems. Then environment and lifestyle. Then anger, stress, and lack of sleep. The person should avoid excessive heat or excessive coldness or sudden change of temperature. Then therapy. Promote the use of bland and soothing creams. Minimize the exposure to soap and other chemicals like synthetic and woolen clothes, and too hot or too cold environment. So in therapy, promote the use of bland and soothing creams. Minimize the exposure to soap and other chemicals, synthetic and woolen clothes, in too hot or too cold environment. Then infantile eczema also includes other eczemas like atopic dermatitis, seborrheic dermatitis, xerotic eczema, napkin dermatitis, contact allergic dermatitis, and secondary eczematization, that is eczematous change as a complication of scabies. The second type is contact dermatitis. First one was atopic dermatitis. Second is contact dermatitis. So contact dermatitis is a term for a skin reaction resulting from exposure to allergens or irritants. Contact dermatitis is a term for skin reaction resulting from exposure to allergens, that is allergic contact dermatitis, or irritants, that is irritant contact dermatitis. Phototoxic dermatitis occurs when allergen or irritant is activated by sunlight. Then types of contact dermatitis. First is allergic, which is resulting from delayed reaction to some allergens such as poison ivy or nickel. Second one is irritant, that is resulting from direct reaction to a solvent. Example, sodium lauryl sulfate, harsh soaps, that is highly alkaline soaps, detergents, and cleaning products. It is most common occupational skin disease. So what is difference of atopic and contact dermatitis? In both the things, there are allergy is common. But in atopic dermatitis, there should be a family history of atopy. So types of contact dermatitis, two types, allergic and irritant. Allergic, resulting from delayed reaction to some allergens such as poison ivy or nickel. And second one is irritant, which is resulting from direct reaction to a solvent. For example, sodium lauryl sulfate, harsh soaps, detergents, cleaning products. That is most common occupational disease. Then contact dermatitis is a localized rash or irritation of the skin caused by contact with foreign substance. Contact dermatitis is a localized rash or irritation of skin caused by contact with foreign substance. Inflammation of the affected tissue is present in the epidermis and the outer dermis. We have seen the layers, epidermis, dermis. So it is the inflammation of affected tissue and it is present in the epidermis, that is outermost layer of the skin, and the outer dermis, that is layer beneath the epidermis. Then contact urticaria. The rash appears within minutes of exposure and fades away within minutes to hours. Contact urticaria rash appears within minutes of exposure and fades away within minutes to hours. But contact dermatitis takes days to fade away. So this is difference between contact urticaria and contact dermatitis. Contact dermatitis takes days to fade away. They fades only if the skin no longer comes in contact with allergen or irritant. Then clinical features. First is red rash. The rash appears immediately in irritant contact dermatitis. In allergic contact dermatitis, the rash sometimes does not appear until 24 to 72 hours after exposure to allergen. So this red rash appears immediately in irritant contact dermatitis, and in allergic contact dermatitis, the rash sometimes does not appear until 24 to 72 hours after exposure to allergen. The meeting will end within less than 1 minute, so you can rejoin again. Second symptom is blisters or wheals. This blisters, wheals, also called as welts, and urticaria, that is hives, often form in pattern where skin was directly exposed to. So in clinical feature, first one is red rash. Second is blister or wheals. These blisters, wheals, and urticaria often form in a pattern where skin was directly exposed to allergen or irritant. Then next is itchy burning skin. Irritant contact dermatitis tends to be more painful than itchy, while allergic contact dermatitis is often itches. So in irritant, it is more painful, and in allergic, it is more itchy. So the picture shows that first one is allergic contact dermatitis. It is caused by the application of antihistamine cream, the acute eczematous reaction, and bilateral periorbital edema. And in second is contact dermatitis due to contact with any irritant. Then diagnosis. First is patch testing. A measured amount and concentration of suspected allergen is applied under conclusion to a patient's back, and the reaction read after 48 hours. What is patch testing? A measured amount and concentration of suspected allergen is applied under the occlusion to the patient's back, and the reaction read after 48 hours. Positive test shows the edematous papules or vesicles. The avoidance of these allergens is necessary for cure of contact dermatitis. Then treatment. First is self-care at home. Immediately after exposure to known allergen or irritant, wash with soap and cool water to remove or inactive most of the offending substances. And second is weak acid solutions like lemon juice, vinegar can be used to counteract the effects of dermatitis contracted by exposure to basic irritants. For example, phenol. So in treatment, first is self-care at home. That is immediately after exposure to known allergen or irritant, wash with soap and cool water. Remove this cool water or soap will remove or inactive the offending substance. Then we can use weak acid solutions like lemon juice, vinegar. This can be best used to counteract the effects of dermatitis which are contracted by exposure to basic irritants. Example is phenol. Then third type, that is seborrheic dermatitis. A form of eczema which is closely related to dandruff. The name itself suggests seborrheic dermatitis. It is a form of eczema which is closely related to dandruff. Also called as cradle cap in infants. And this is endogenous type of eczema. Area affected is mainly scalp and face. Etiology. The cause of seborrheic dermatitis remains unknown, although many factors have been implicated. The widely present are yeast, Malassezia furfur, formerly known as Pityrosporum oval, are involved. Then genetic, environmental, hormonal, and immune system factors also have special role. In children, excessive vitamin A intake can cause seborrheic dermatitis. In children, excessive vitamin A intake can cause seborrheic dermatitis. Then lack of biotin, pyridoxine, that is vitamin B6, riboflavin, vitamin B2 may also cause. So in etiology, in many cases, it is unknown. In some cases, it may be due to yeast or Malassezia furfur. In some cases, it is genetic, environmental, hormonal, or immune system factors. In children, excessive vitamin A intake can cause seborrheic dermatitis. Then lack of biotin, pyridoxine, and riboflavin may also be a cause. Then side effects. So first side effect is hair loss. So side effects to this inflammation may include temporary hair loss. If severe outbreaks are untreated for extended intervals, permanent hair loss may result because of damage to hair follicles. You can see the images. First one is seborrheic dermatitis showing central facial erythema with overlying greasy yellowish scales. And second one is seborrheic dermatitis involving the chest and armpits. Seborrheic dermatitis involving the chest and armpits. Then differential diagnosis. In groin area, it can be the flexural psoriasis, which affect other areas also. Ringworm infections. In groin area, flexural psoriasis. But it can affect other areas also. Second one is ringworm infection, that is Tinea cruris. It is not symmetrical. Intertrigo, it is symmetrical. Clothing dermatitis, so it can affect other areas also. In chronic benign familial pemphigus, so it shows family history. Next type is nummular eczema or discoid eczema. So nummular means coin shaped. The nummular areas of acute or subacute eczema over the extensors of extremities, especially dorso of fingers, hands and feet. So it is the combined type, endogenous and exogenous. Both factors are responsible. So see the image, nummular eczema or discoid eczema. It is coin shaped. The next type is xerotic eczema. Other names of xerotic eczema are steatotic eczema, eczema craculae or craculatum, winter itch, pruritus himalis. The name itself suggests xerotic. Xerotic means dry. So it is a dry skin that becomes so serious, so it turns into eczema. It worsens in dry winter weather. Here, limbs and trunks are the most often affected. Cheeks and sides of the face are commonly involved in children. It is seen especially on the anterior surface of the lower extremities in elderly patients. And it shows fine cracks and scales with or without erythema, characteristically developed in areas of dry skin. And therapy for this xerotic eczema: avoidance of soap or sparing the use of mild soap like glycerin containing or mild alkaline or moisturizing soap. Then next is frequent application of cold cream, which is oil based, or vanishing cream, which is water based. And correction of predisposing factor, which is essential for maintaining remission. Then next is lichen simplex chronicus, also called as circumscribed neurodermatitis. Lichen simplex chronicus. So this is the result of persistent rubbing and scratching of area of the skin. Initiating cause of pruritus, it may be chemical or mechanical irritation, allergic contact dermatitis, atopy, or habit tic, that is neurodermatitis. Cause can be anything, and the cycle will be same, that is itch, scratch, then itch. Lichen simplex chronicus, that is circumscribed neurodermatitis. This is the result of persistent rubbing and scratching of an area of the skin. Initiating cause of pruritus is chemical or mechanical irritation, allergic contact dermatitis, atopy, and a habit tic, that is neurodermatitis. Cause can be anything, and the cycle will be same, that is itch, which leads to scratching, scratching leads to itching. Morphology: it is fairly well defined, hyperpigmented plaques with prominence of normal crisscross skin markings. Thickened skin shows tiny crusts or erosions because of scratching. Areas: dorso of feet, ankles, wrist, and extensor forearm. So next part will continue with next lecture. If any doubt, you can call me or message me personally. Thank you. You can leave the meeting.